before March 2025, Cwrt Mytton was purely paper-based. Yeah. So what do you think, what were your frustrations? What were your staff telling you? And why did you decide that you needed help from PredicAire?
Specifically, the communication was not great. We had many forms of communication, lots of handovers. There was people felt disappointed with the service we was providing in terms of when we was having to review information, we had to get it from every different place. When we had to update information, it was going through three different forms. So basically, I think the frustrations were that it wasn't fully accessible and up to date. I feel like it was always out of date all the time, rather than being live and in time. It was always out of date, and it was daily struggles. Obviously, you've also got the cost of being paper-based as well. That's also a factor into it. We was always having to photocopy. There was information everywhere, how we were storing paper information. All of our storerooms was going, was full. So there is lots of aspects that was difficult being paper-based.
That must have taken up so much time as well, did it, in terms of like your staff?
Our staff was always writing in books. If we seen them, they were sat there writing in books. There was books in their bedrooms, books on the units, even though they were safe, they were the residents. But the time that it took to do that information was outweighing anything, really.
Okay. Well, I mean, that makes sense, doesn't it? If you can save time at all, then that's only going to help your residents, I suppose, isn't it?
And that's what I've done. It freed up a lot of time to spend with the individuals, and be more person-centred and actually deliver the care rather than always being worried about the documentation. The documentation was coming first rather than the aspect of the person-centred care, because obviously staff get worried that they're not writing up all the documents,